Hi, Lena. Hi, Lena.
Everyone, and welcome to today's Model Aquatic Health Code Network webinar. It's a pleasure to welcome everyone here. My name is Daisy Galan, and I'm a lead program analyst at the National Association of County and City Health Officials, NACHO. I will be moderating today's webinar, and I just wanted to provide a few reminders before we get started. This webinar is being recorded, and we will share the presentation along with today's recording to all the registrants after the webinar. Also, please feel free to submit any questions that you have via our Q&A box. We will have some time at the end where we will address all the questions that you might have. Next slides, please. So today we're going to start with a few announcements provided by our colleagues at CDC about Health and Safe Swimming Week and the 4th edition of the MAHC. Afterwards, I will introduce our speaker, Dewey Case, and he will be talking to us about understanding increased risk venues. And then at the end, as I mentioned, it will be followed by a Q&A session. Next slide, please. With that, I want to welcome Samaria Luco. Samaria is an Oak Ridge Institute for Science and Education, or RISE Fellow at the CDC with the Health Swimming and Safe program and also the Model Aquatic Health Code. Samaria is a graduate of Tempe University with a degree in epidemiology, and she has worked on outbreak investigations of recreational water-associated illness and collaborates with public health authorities and the aquatic sectors to develop science-based prevention and control measures. Samaria, welcome, and I will pass the floor to you now with some updates from CDC.
Hey, thank you, Daisy, and good afternoon, everyone. So today I will just be briefly covering our updates for the 4th edition Model Aquatic Health Code and then Healthy and Safe Swimming Week. which has officially began yesterday, and it's running until Sunday, the 29th. And as you can see, our theme this year is Make a Healthy Splash, Stay Healthy and Safe in Splash Pads. Next slide, please. Okay, so this year's campaign and communication resources, they can be accessed at the links shown here. And starting with our toolkit, it's packed with some sample social media messages, graphics, press release templates, and also outreach suggestions. And then we also have 2 new web pages that are covering how to stop the spread of germs and then operating and managing splash pads. And it also includes an updated infographic on how to stay safe at these splash pads. And then lastly, we do have a report on the investigation of outbreaks that are associated with the splash pad in the Kansas Wildlife Park. You can look for that coming later this summer, and this outbreak occurred last summer. And then, as always, we do highlight this information this week in particular, but we do encourage you all to reference it throughout the year to prevent any injury and illness when swimming. Next slide, please. And then I'll run through our tentative timeline for the 4th edition MAHC release. It's currently making its way through CDC clearance, which is very exciting to hear. We submitted in March, and it's already passed through 2 centers and 1 office. And then once it's cleared through the remaining centers and offices, we estimate about another 6 weeks to make it ADA 508 compliant. And then it'll be posted on our CDC website this summer with the link included right there. And these are our updates, and I'm looking forward to another swim season. We hope you all take the time to review these pages and stay safe. Back to you, Daisy.
Thank you so much for joining us, Maria. It's now my pleasure to introduce today's speaker, Dewey Case. Dewey serves as the Technical Director for the Council for the Model Aquatic Health Code. He has over 22 years of experience in commercial aquatics industry. His career started as a part-time lifeguard, evolved into serving pools. Then he began managing aquatic facilities while in college. Dewey has served in various roles with the YMCA of the USA, the local and state chapters of the American Red Cross, on the Lifeguarding and Behavior Supervision Technical Committee for the MAHC First Edition, and on the Technical Review Committee for the MAHC Third Edition, as well as managing aquatic facilities for the YMCA of Southwest Mississippi for 19 years. Dewey holds multiple instructor trainer certifications from the American Red Cross, as well as instructor credentials with the Pool and Hot Tub Alliance. In addition to his duties at the CMAC, Dewey is also the commercial sales manager for Adcock Pool and Spa in Hattiesburg, Mississippi. So it's a pleasure, Dewey, to have you here as our speaker, and I will now turn it over to you for today's presentation.
It'd help if I was unmuted. Thank you very much, Daisy. Appreciate that. So today we're going to talk about understanding increased risk venues. And the goal here is to give everyone kind of a 50,000 foot view into what these are, what some of the issues that exist at these facilities, and what are some of our concerns. Do know that I'll be wearing kind of 2 hats with this. One is my technical director hat for CMAC, and where it's appropriate, I also mention things that I've noticed as an operator seeing multiple venues over the years. So I'll make sure to make clear delineations for that. Before we get started, I just do want to thank everyone for what you do as a health official. We're entering into the beginning of the official beginning of the summer season with Memorial Day on Monday. And I'm quite certain that your stress levels are rising. You're doing a bunch of pool inspections, and hopefully it'll be a smooth summer. But as a health official, you get to be the bad guy. And so I just want to make sure you know that as a health official, you are valued, you are important, and you're critical to keeping our pools safe, and you are appreciated. So thank you for your upcoming efforts this year. Next slide, please. So what is an increased risk venue? I've thrown in the definition straight from the MAHC, and I'll paraphrase for this. Generally speaking, an increased risk venue is defined as therapy pools and also wading pools and splash pads. So venues where individuals younger than 5 years old are going to frequently use and be common at, are also those that are immunocompromised or may have open wounds. So that just kind of defines our discussion today on this increased risk venue, steering into wading pools, into therapy pools, and of course, as the theme for Healthy and Safe Swimming Week, splash pads. Next slide, please. So we just mentioned what this includes: spray pads, wading pools, and therapy pools. Next slide, please. So what are some of the issues with these things, right? So what are some of the key risk factors? With spray pads and wading pools, we both see very, very small volumes of water. When you think about the number of users and the volume of water here with these venues, we don't see the traditional bank of chlorinated filtered water that we do in a larger pool. The per gallon use, which is even more important, is very, very slow. It's a very, very small ratio. And that small volume of water matters with these. As we have small bodies of water, they can be very difficult to maintain water quality and definitely difficult to maintain sanitation and pH control. In addition, specifically with spray pads, you have aeration, which can impact water quality as well. And all of these things kind of make these venues a little bit more challenging to keep safe and sanitary and healthy. When we talk about therapy pools, which is listed as an increased risk venue, again, we're seeing a small volume of water with also higher temperatures. And it's not uncommon in the therapy pools to see bather densities a little bit on the higher end, depending on how that particular facility opts to use the therapy pool. And we'll talk a little bit more about that in a later slide. Next slide, please. So when we talk about bather characteristics, and this is an important thing to toss into the mix, when we talk about spray pads, they tend to be younger children, tend to be under 10 years of age. We certainly see a lot of children that use spray pads that are in the 4, 5, 6-year-old range. And when we have this particular bather, we see a couple of things that are interesting. They're likely to ingest water either on accident or on purpose. We've certainly seen plenty of 4-year-olds, 5-year-olds, or even a 3-year-old that's ran up to a spray feature and just kind of put their mouth on the spray feature, right? And let that spray water get in their mouth. We try to discourage that. We obviously don't want to see that. But I know I've seen that on more than one occasion. It's just the nature of children playing in these venues. And also, whenever we have younger children, they can be in the process of potty training. Now, obviously, we're not going to see a 1-year-old or a baby necessarily playing in the spray pads for a variety of different reasons. But we could still see that 2 or 3-year-old that maybe they're not potty trained yet, or maybe there's some other issue that's impacting their ability to hold their bowels, for lack of a better word, right? Next slide, please. When we see wading pools, this is kind of what we think of as baby pools, right? So very shallow, very small volume of water, and almost entirely very small children. And again, some of this doesn't necessarily come from the MAHC. These comes from my observations as an operator, so I want to make that very clear. But when we talk about being health and safety, and we talk about these venues, we have to take into account bather characteristics and bather behaviors. So with wading pools, we're talking about very, very small children on average. once a child gets to be 4 or 5 years old, they're not really going to want to play in the wading pool. They're going to join their older brothers and sisters, their older friends or older children in the splash pad or in whatever main venue may be present at that facility. One thing important to note, or two things important to note with these wading pools, is that children are most likely going to be in potty training and or they're not fully potty trained yet. So what's significant? Well, the obvious answer is this leads to a higher risk, so to speak, of fecal matter being released into this wading pool. And another characteristic that we really have to focus on is, as we remember with young children, under the age of 3 to definitely under the age of 1, they tend to explore their world orally, right? So we've all seen small children take a toy, put it in their mouth. They take an object, putting in their mouth. They tend to taste, they tend to explore through their mouth, very much the same way in the water, right? So whether it's actually what old swim instructors refer to as shipping, where they take water in their mouth and spit it out, obviously having a route of exposure, or taking objects such as pool toys and putting them in their mouth, whether they're a communal toy shared by the facility or a toy that they bring, that exposure to that water can be concerning, from an oral ingestion standpoint, right? So these makes wading pools and spray pads very much a very interesting thing to be concerned about from a bacteria standpoint, from an illness standpoint, from a disease spread standpoint. Next slide, please. When we see therapy pools, right, here's where things get even more interesting. So we have to define what a therapy pool is. The MAHC definition of a therapy pool is one that is only used for therapy pool. So you're not going to, per the MAHC definition, necessarily see other individuals integrated into this operation. Now, putting my operator hat on, as many health officials have probably noticed, a facility may build a therapy pool, but what it really is more of a general use pool. They run high water temperatures, typically in the 90s, maybe upper 90s. They'll bring in older adults. Maybe they'll contract out with other entities to do actual physical therapy and rehab. And then later in the day, they may have some mixed use. They may bring children in to do a parent-child learn to swim class, or they may do an organized swim class for younger children that are beyond the parent-child level, right? It's a consideration we have to think about. It's not the technical use per the MAHC of what a therapy pool is. And, we can certainly have that debate on whether or not those facilities should allow these behaviors. But the honest answer is, we see this happening, right? So it's something to think about. And it's this mixing of high-risk groups that makes facilities that use therapy pools in this manner to be even more concerning from a health standpoint. So when we stick with the MAHC definition of a therapy pool, which is going to be one only used for therapy, generally we see older adults. Now, obviously, if you have a younger adult, 20s, 30s, that have suffered an injury, severe injury from a car wreck, sports injuries specifically, and there are children that need physical therapy as well, you can see these these differing age ranges mixed into this therapy pool, right? So again, we see the same mixing concerns where if you have a 3-year-old that needs therapy, think cerebral palsy, then they may wind up in these therapy pools. And again, we see that mixing of risk for fecal incidents. But typically, we see older individuals using therapy pools for therapy on a more common basis. These older adults tend to be immunocompromised for one reason or another. They tend to have post-surgery wounds that are still healing. And then aging and other disease and comorbidities such as diabetes can have an impact where wounds are slow to heal. That's a well-known issue with diabetics where wound healing is a problem. And then also as an adult ages, they may have incontinence issues as well. So again, we're leading to the potential fecal matter being released into this pool. And that's kind of the trend, right? So when we look at spray pads, when we look at wading pools, when we look at therapy pools, we see the smaller volumes of water. We see individuals that may have bowel issues and issues holding fecal matter in, however we want to describe that. And we tend to see a high risk of fecal matter being introduced into these bodies of water. And this is what makes them really, really difficult to deal with, right? Next slide, please. So what's our primary concern? Well, we've mentioned that. It's accidental fecal releases, right? So all the enteric-related illnesses such as Cryptosporidium, Giardia, Shigella, and E. coli. We've seen outbreaks at these types of facilities with virtually all of these diseases for years. And it's still a concern, right? And the concern is because primarily the bather characteristics, right? We see additional concerns with staph and MRSA. Now, please note that we're not talking about from the water, right? So very, very low levels of chlorine tend to be very effective on MRSA and staph. They're not particularly a pathogen that is particularly chlorine resistant, but we do worry about pool surfaces, right? So that's where we may see the issues from staph and MRSA. And we also see just general infections from poorly maintained water. And that's the key, right? So where chlorine's not consistent, maybe chlorine's too low, pH is off, that impacts the chlorine effectiveness. There's not having a secondary system, right? Disinfection system. And just generally operators that aren't maintaining the water that well. Or maybe the operators are doing their best, but the systems themselves aren't designed to help enforce and reinforce that proper operation, right? And I have to say that whether we're talking about spray pads, wading pools, therapy pools, spas, larger venues, operators are a key, right? And having individuals that can operate that pool well is an invaluable component of not spreading disease, right? Of pathogen control, infection control. The qualified operator who's knowledgeable is just as important of a factor as the equipment, right? And also we see primary concerns. We have to talk about immunocompromised. Not that the water itself is any different, right? But just whenever you have someone immunocompromised and there is a illness concern or there's a spread of illness, such as Giardia, then that particular immunocompromised person is going to be at a higher risk. They may have more issues, and this could become a bigger concern, whereas myself, the other panelists, we're in the age range where we can fight this off, relatively well. But immunocompromised persons will certainly have more issues. Next slide, please. So what are additional concerns? Physical safety is a huge one. So when we talk about drowning risk, again, we go back to those bather characteristics. We talk about toddler proportions. So what is this, right? So toddlers, when you have that 2- and 3-year-old, proportionally, the head is not the same ratio to the body, right? So when we look at adults, we see very, very smooth and very, very good proportion, so to speak. The head's not abnormally large, right? With a toddler, the rate of growth, toddlers tend to have a slightly larger head in proportion to their body, which makes them top heavy. So oftentimes when a toddler does fall over, they don't have the body strength to offset that disproportional head size. So toddlers are certainly at a drowning risk for that, and that's on top of swimming ability and also cognitive ability. We see older persons in warm water. So why is this a concern or a link for drowning? Well, warm water can aggravate medications, can exacerbate medications, can exacerbate illnesses. and older individuals tend to be more heat susceptible as well. And then also perceptions, right? So one big perception is, it's shallow water, right? Kid's not going to drown in shallow water. Yeah, they can. That's in fact where most of them do drown, right? We know from our stats, number one cause of drowning deaths for small children under the age of 4 is going to be bathtubs and buckets, right, and toilets. And that's certainly not the same water gallons we're seeing for these venues that we have, right? Accidental entry is a large concern for physical safety. So we want to make sure we have proper barriers and closures. Slips and falls, especially with spray pads, as virtually the entire area of the spray pad is going to be wet the entire time, right? So not only is it the surface issue, but it's also whatever contaminants and buildup, mildew, et cetera, that may be growing on that surface that adds to that slip risk. And of course, when we talk about physical injuries, we have to mention the Virginia Graham-Baker Act. All pools should be compliant at this point. However, we know that there are some pools that are not for various reasons, mostly oversight. Maybe it's an area with lack of inspectors, or maybe it's just an inspector education issue, or the inspector is overwhelmed and hasn't gotten back to that pool yet. But certainly Virginia Graham-Baker Act for suction entrapment with these small bodies of water where the main drain is very close to the surface of the water compared to a swimming pool, right? Inches, foot max, excuse me, versus 10, 12 feet. Another concern we have for physical injury is going to be excessive flow or pressure from any features, right? So these are bubblers and spray nozzles where the designer didn't set the flow correctly, and now the velocities of it are at risk of causing injuries, especially to smaller children. Next slide, please. So when we talk about the MAHC, right? So how does the MAHC address all of these? The answer is in pretty staggering detail, right? So one thing from a design and construction standpoint that the MAHC addresses is that we have to have secondary disinfection. So all increased risk venues, because of the risk of these pathogens and because of the small body of water and because of the higher density compared to the pool water itself, and because of all these challenges, the MAHC does indicate that they should have secondary disinfection, right? Well, whether this is ozone or ultraviolet light, that is left up for discussion. But you have to have some sort of secondary disinfection with these facilities, right? And that's to kill the bugs, kill the pathogens. We know that these pathogens, once we start throwing in UV, once we start throwing in ozone, that the kill rates go dramatically higher, and that those venues really help set the tone for keeping this facility safe. One of those little things in design and construction that we don't think about are hygiene facilities, right? We've never really thought about hygiene. We always focus on chlorine and secondary disinfection, pH control, but having hygiene facilities less than 200 feet from wading pools and spray pads. That's an important thing because that helps encourage children to go to the bathroom. And then they're using the toilet in the bathroom where it should be versus holding it because the distance is too far, the bathroom's not easily accessible, and ending up having an accidental fecal response, right? We see in the design and construction section for the MAHC, we see specific sections for therapy pools, for interactive water features, AKA splash pads, and also for wading pools. And these specific factors go to help with reduce the slip and falls, to help make sure that they're flowing properly, to help make sure that they're designed properly and they have secondary disinfection. Next slide, please. With operations and maintenance, right? We see, and also keep in mind, right, that I have flow rates and turnovers listed here in operations and maintenance. It's also going to be in design and construction, right? So it's kind of cool how the MAHC is developed. and that every section addresses all of these issues: physical risk, health risk, right? And that's one of the novel things about the MAHC that makes it totally unique compared to any other code. So again, we see flow rates and turnovers, and we have to emphasize proper flow rates and proper turnovers with these venues, not only because of suction entrapment, but also we want to make sure that that water is turning over and filtering appropriately and getting treated appropriately to where we have the real lowest possible risk for these venues. So for example, for flow rates and turnovers, if we go back to design and construction, section 4.7.1.10, we see that interactive play features is a half hour or less turnover. Pretty good, pretty good turnover for that, right? That water's coming back through, it's hitting the filter, it's hitting the UV, the secondary disinfection, it's hitting the sanitizing system very, very quickly, right? And we know that that goes a long way to reducing this risk for this venue. We also see where automated controllers and equipment monitoring, right? We see where the MAHC requires controllers after 1 year of adoption, okay? As a former operator and a current operator, I have to tell you that there is one of the most underrated things, right, that go to helping health and safety in the water, helping water quality, and helping reduce the risk of pathogens is automation. The worst thing any facility can do is hand feed, right? Because then you have dips, you have peaks and valleys, and that's just begging for these pathogens to take root and grow and become an issue very, very quickly. The second worst thing you can do as a facility is have no automation. You may have a feeder on, you might be hand feeding pH control, right? Which means you'll have these peaks and valleys, peaks where chlorine is not effective and valleys where pH may be too low and unsafe. And you have erosion feeders that are just kind of a constant flow. And generally these are always problematic, right? So with automated controllers, you will see a more consistent stream. You'll see the ability for that controller to interact very quickly, right? So to whatever issue may be. So automated controllers is not a panacea. It doesn't solve all the problems, but they're important on all aquatic venues, and they're critical on these increased risk venues, right? Again, that's my opinion. The MAHC doesn't necessarily mandate from the very beginning, but it does say from 1 year from an adoption that these controllers should be in, right? You really want to see these controllers with the secondary disinfection from the very get-go with these facilities, with these increased risk venues to really, really lower that risk of infection. Next slide, please. For section 6 in policies and management, right? Well, this deals with staff, doesn't it? It deals with people as well. Most notable in here is having a safety plan as a facility. This is for guarded and unguarded pools. We generally think of safety plans for guarded facilities, but a lot of these elements we can see in unguarded pools as well, your hotel pools, your HOA pools, right? And what's unique about the safety plan is it requires that a facility has a biohazard response plan, which includes fecal incidents, right? So kind of that old adage, right? Those who fail to plan to fail, right? So if you're not actively trying to prevent fecal incidents and accidental fecal releases, pardon me, then you're more likely to invite these into your facilities. In policies and management, we see daily water monitoring and testing records, right? So the facility actually making sure that they're testing on a regular basis to make sure that chlorine and pH, ORP, everything is online to where it's a safe and healthy pool. We see sign messages, right? So this includes the please, right? Please don't swim if you've had diarrhea. Please take a shower and that type of languaging. Same thing with hygiene facility signages, right? To where in the hygiene facility, facilities are reinforcing this, make sure you're clean, right? Make sure you're bathed and don't swim if you've had diarrhea. So the facilities have multiple touch points where this messaging is important, right? Now, we all know that messaging won't prevent everything, right? We know that there are individuals that will certainly ignore messaging. However, what we'll never know is how messaging and how signage will prevent incidents, right? Find out that data. So facilities that are on the fence with some of this messaging, thinking that they'll never do it, well, the point is you'll never truly know, right? Because the point is the signage is present, and then it's this passive thing that's changing the behaviors of the users, the bathers, the guests, to where they're actively not swimming if they have these particular conditions, right? And these particular illnesses. So the messaging is really important. So again, throughout all the sections of the MAHC, we see this reiteration of keeping people healthy, keeping people safe, and reducing the risk of fecal-related illnesses being spread through our pool waters. Next slide, please. So when we talk about policies and management, something else to throw on there, and this is just to make sure that people are aware it exists, right? Legionella is not a real big concern for spray pads or wading pools. The water is not quite where it needs to be at temperature-wise to really encourage Legionella. Full disclosure, I am not a Legionella expert per se, but the conversations I've had about Legionella, this is kind of what it leads to, right? It's not a concern for those venues. However, I do want to point out that in spa specifically, we do see a concerning trend of Legionella. Nothing that's, pie in the sky, skies falling down, not panic mode, but enough to where we should be concerned and more attentive. So I do want to point out that the MAHC does have the Legionella decontamination protocol in section 6.5.3.6 to be specific. Next slide, please. So, when we talk about additional considerations, right? So filtration matters. We've known that, we've long known that filtration matters. Microns matter, right? Packing up and capturing these very, very small particles that include crypto and include these various pathogens. There is a process in place for filter credits for crypto removal if you have filters that meet certain specifications. And then this is not, necessarily not going to jump into this for today, but there's some interesting research being done by Dr. James Ambergy out of University of North Carolina on filtration that kind of reinforces, the type of filtration matters for crypto removal. And this includes kind of a conversation around, filters and NSF 50 versus NSF 61, right? So NSF 50, as we're all well versed in, is the standards for swimming pool related products. NSF 61 is for drinking water. There's some interesting nuggets there to look at. And these are discussions that are being had now as how do we look at this? How do we address this? Should we address this, right? Should we look at other filters that are NSF 61 versus 50, right? And it's very raw and it's very new, and we're not necessarily jumping. No one is jumping very far, very fast with it, but it's something to think about, right? And probably it's beyond the discussion for this presentation, but we will look at having future presentations that kind of discuss these concepts more. Next slide, please. So an honorable mention for the increased risk venue, and that's going to be spas, right? Spas are not listed as an increased risk venue. However, they are concerning, right? We see very small volumes of water. We see high temperatures that can contribute to microbial concerns. Spas are difficult for an operator to maintain because of the increased temperature and small volume of water. Oftentimes, they're not drained or cleaned anywhere near frequently enough, even when you're using the formula listed in the MAHC, right? The average owner operator may not understand all the risks, Legionella, right, folliculitis. And then, while not submerged, the aerosolation of the water and that person breathing it in, that bather breathing it in, can contribute to disease transmission, right? And again, an emerging serious concern with spas is Legionella. Sky's not falling down yet, but as a health official, that's something to be on your radar and think about maybe a little bit more, right? And then, of course, for more information on spas, refer to MAHC section 4.12.1. Next slide, please. All right. So just kind of a summary of actions, right? For all of these things. And again, the emphasis is on spray pads for this week for Health and Safe Swimming Week. And spray pads are where we're going to see a lot of exposure. There are millions of people every year that use spray pads, right? So proper design. We want to make sure that they're designed with automation, that they're designed mandatory with secondary disinfection, right? We want to make sure that they're having a half-hour turnover. And along with proper design, don't forget about ease of maintenance. A lot of designers, or some designers and builders, I should say, will put some of the equipment, especially the holding tank, in hard to reach places. So we really want to see the ease of maintenance, right? Where these holding tanks for the venue water can be easily drained, easily cleaned, right? That's a really important component, right? Speccing proper equipment out, maintaining secondary disinfection, right? These are all issues with design and construction that's absolutely critical. On the operations aspect of it, ensuring proper sanitizer and pH, right? This is not necessarily, these venues are not necessarily somewhere you want to go with the lower end of the chlorine range, right? So maybe go a little bit higher range, right? That's something to think about. Maybe the pH, instead of being 7.5, 7.6, we shoot for 7.3, right? 7.4, just to get a little bit more efficacy out of that chlorine level, right? So make sure they're on automation, and consistency is absolutely key. Make sure that not only chlorine and pH are being controlled consistently, making sure that UV is being consistently introduced into the water stream, but also that the owner operator are taking actions to be consistent with daily water testing, right? Cleaning, their own inspections, etc., right? And then also operator and owners understanding that they have a responsibility. These things aren't just plug and go and let them run. They definitely have to be active in their operation, right? On the management aspect, right, summary of actions, proper training, and especially for the owner operator, and how to operate these facilities, what's required. Just can't emphasize that enough. If we could just get all these facilities to invest in these summary of actions, we would see our concerns about pathogen spread, illness spread, and spray pads, wading pools, and therapy pools. We'd see these really, really drop, right? It would make everybody just so happy to see the positive impact that these three summary of actions would have in health and safety, right? And swimmer health. And of course, changing behaviors through messaging and signs, right? So these are all kind of three summary of actions that we need to think about when we look at preventing disease. Next slide, please. Okay. So one thing I just have to always point out, right, it's kind of every presentation we do, is if you're not a CMAQ member, consider joining today, right? So it's important that we have your support, right, with the work that we do in working with CDC to update the MAHC and maintain the MAHC, but also in our efforts to do things like this today and the other presentations and webinars that we do and the other activities we do, right? We're driven by your expertise. So that means that we need you and your expertise and you being an expert to help us be the best we can. And if we can be great through your greatness, then we can go out and we can really make everything healthy and really support the industry, support owner operators, support public health, which is huge for us. And, really, hopefully in 10 years, wind up out of a job because everybody's healthy, right? So that's kind of our goal, right? Next slide, please. All right, and with that, I think we have a Q&A period. Daisy, I will turn it back over to you as a moderator.
Well, thank you so much, Dewey. What a wonderful presentation with so much information for all of us. So we will now open the next 15 minutes or so for our Q&A session. So for those who are joining us, you're welcome to submit questions via our Q&A box. I've seen some questions coming in throughout the webinar, and I know we also have our CDC partners here with us, and Joe Lako is with us also helping us answering some of these questions. So feel free to add your questions to the Q&A box and also upvote them if there's specific questions that you like to be on top of our list. Dewey, I'm gonna start with some of the questions that were also already answered here in a Q&A box, but I think it's important for us also to ask them live. So if there's anything else you and Joe or others who are here, our partners would like to add. So we talked a lot about the different types of venues and what make them for an increased risk. But one of the questions is about water temperature. So is the water temperature over 90 degrees something that makes a venue with an increased risk for biological problems? And do you have anything about the MAHC or MAHC guidance that you guys would like to add?
Well, you know, temperatures above 92 degrees gets to be a little interesting thing. And I may have to kick to Michelle or Joe for some of the data sets on this. We really get concerned once it starts hitting about 100. That seems to be, once you hit that 100 range, that seems to be the point to where, okay, this is really an issue, right? But we can't rule out that water temperature has this increased concern, right? So in fact, if you look at the MAHC, right, page 56, and don't ask me to have anything else by memory. I just happen to have it open here, right? Page 56, we do see maximum turnover times for spas and therapy pools, and there is a correlation to water temperature, right? So it is something to think about. And it's probably an area that we do need more data on when we look at water temperatures 92 degrees up to 98, 99. What are the risks there microbially? What does that water promote? That is a gap that maybe we need a little bit more information on.
And this is Michelle from CDC. I do want to add to that. So when you have increased water temperature, you have increased disinfection demand. We see that as Dewey hinted toward, by the time we get to hot tubs, the temperature is going to affect and deplete the free chlorine concentration. I do want to go take a step back a little bit to what Dewey said before. I mean, I just want to, where he talked about Legionella and hot tubs. I think the key thing to remember with hot tubs is that you're aerosolizing water, and that water is contaminated with bacteria and you're inhaling it in. What you'll see when we put out our outbreak reports, at least in the past, when we put out those like small little books on outbreak reports, you often saw that like a Legionella outbreak was potentially associated with a hot tub and a pool. There's no reason to think that a pool will transmit Legionella or spread Legionella. The reason for that is, one, the temperature, as Dewey said, but more importantly, you're not aerosolizing water. The hot tub jets aerosolize the water. So that's really what the concern is there.
Thank you so much, Michelle, and thank you, Dewey. Our next question is very important for all our local health department members for joining the call. So what should be local health departments with limited resource? What can they prioritize for increased risk facilities? Should that be plan review, pre-operating inspection, recurring inspection of existing facilities? or operator training. Do you guys have any recommendations?
This is Joe Lako at CDC, and I just got done reading that question, and all of those are really great ideas, and it's really hard to prioritize. But like Dewey said, they're not just plug and play type of venues. So once you have a good plan, once it's been inspected prior to operation, people need to know how to maintain it. And it does need continual monitoring and continual adjustments made to make sure that the water balance is all within parameters, particularly that disinfectant. So maybe the answer is yes. Maybe the answer is yes, all of those.
Yeah, I was about to say, Joe, I look at that and everything is concerned, right? If I had to pick one off the list, right, that, you know, if I had to pick one, I'd probably go with recurring inspections, right? Just because these facilities are a bit more interesting, right? And things change from day to day. Just the health inspector having eyes on things to be able to pick up more from a standpoint that's not concerned about the till, right, or revenue or anything like that. Maybe that's one I would pick if I had to pick. But again, you know, echoing Joe, all of those things are super important.
This is Michelle, and I would say this is, you know, we all have limited resources, and I think with the Great Recession and pool programs being cut and you know, just things not looking really well right now, I think you got to prioritize where your problems are. I mean, if you've got a water park or small water park in your jurisdiction, and you know all the operators are trained, they've never had an issue. I mean, granted, they have more people exposed there, but if things are going well there, I would put that lower on the list, and I would put the hotel pool with maybe less swimmers, but maybe 2 Legionellosis outbreaks in the last 2 years high on my list. I think what this really highlights is, you know, having to go back to your data. If there's any way you can look at your inspection data and let the data lead you to where you need to be going. Where have my problems been? What training can I do to eliminate my top 3 violations? Like, if everybody is just not understanding chemical safety, well, you know, that's what you focus on. If you're writing up people or noting issues with pool chemical safety, that's where you focus. I don't know, Joe, what do you think?
Yeah, I like the way you put that, Michelle. Sometimes if you've got limited resources, the low-hanging fruit is what you got to focus on. And while Dewey and Michelle were talking, I couldn't help but think, if I had to pick one, this is just Joe Lako's opinion, I would focus on, this is just me, on the operator training and having operators really have an understanding of how these systems work and how they can do their own monitoring to make sure things are in check before an issue arises.
Yeah. You know, the answer to that question is going to vary to who you talk with, you know. So, you know, a couple of different answers on that particular one now. You throw a designer in, and they're going to focus on the design side of it. So it's really an interesting question. And we keep going back around to yes to all, right? So very, very interesting one.
Thank you all for this great discussion. And I think this is a very important question for all our members. So we have some additional questions here in the Q&A box. So going back to our spray pads, are there safety standards for play equipment on spray pads? For example, pressure of the water jet?
I am blanking in the MAC. I would have to search that out to see. I have heard of references to like a velocity, right? It's not really pressure, it's more velocity, feet per second. But I don't have confidence in that right now. So Daisy, if you can maybe shoot me an email offline, we can research that and get an answer to you.
I would also carefully read the manufacturer's installation instructions and operator instructions and follow the guidelines they have set for their safety features that are built into the nozzles and such.
Well, thank you both. We'll make a note of this, and Michael will follow up with you on that question as well. The next question is related to the correlation between the age of the splash pad and the wading pool construction and outbreaks over the last decade. Have you guys seen any information on that?
You know, I haven't seen any direct studies, but I would think that there's more of a correlation with your preventative maintenance of your equipment and your pipes and your filters and all of the bits and pieces that make up your recirculation system despite its age. I think the longer something is in operation, there may be a higher likelihood for a biofilm to accumulate, particularly in these smaller water systems like Dewey was explaining today, and within spas. I would also really focus on and pay attention to maintenance on your filters and discharging the backflow for those.
This is Michelle. In the National Outbreak Reporting System, where our state and territorial and tribal partners can report outbreaks, whether they be recreational water associated outbreaks or foodborne outbreaks. The recreational water outbreak data that we get is really, really limited. Like I think some of the barriers to reporting data from outbreak investigations, you know, on like what year was the pool built and all that data doesn't really get into the system. We don't even know if the pools associated with outbreaks have cyanuric acid in them, and I would love to get those data. We would really encourage our state environmental health colleagues and territorial and tribal colleagues that specialize in environmental health to talk to their epidemiologists who are reporting these outbreaks. One thing we've done is with recreational water associated outbreaks, the reporting of them used to be 10 pages long. We've really slashed that down. I'm not sure if that new edition is up yet. I know they're in the process of getting it up. We really slashed that down to like 2-3 pages. I would rather know whether or not these outbreak associated pools have cyanuric acid in them or not, then get in all the other details. And so we've tried to really minimize it. But the nice thing is our state partners now have the opportunity to upload reports. So when the epidemiologist writes a summary report, or when an environmental health specialist does an inspection, those documents can be directly uploaded into the system so that we can start looking at those data. If we don't get those data, we can't analyze them. But the nice thing is that you can upload your reports along with the outbreak reporting, and then you don't have to enter the data. We take care of that on our end.
Thank you. So the next question is related to biofilms, and it's to ask the panel if you guys are familiar with the use of MAHC for reducing CAC, and if this will be an issue with biofilms, and there's anything on this on the MAC.
You know, the issue with MAHC is, and I am familiar with MAHC and plant life being used for filtration, you know, specifically, you know, and definitely don't want to necessarily hold back innovation. But one of the issues with MAHC is that it's going to be really hard to test for NSF 50 certification or NSF 61. You know, that is a concern. So yeah, I'm familiar with it. How would that impact biofilm? That's a very, very good question. I know I don't know the answer to that.
So last year, CDC looked at 17 waterborne infectious diseases and estimated that there were about over 7 million waterborne illnesses occurring in the US each year. The leading cause of waterborne, or the leading waterborne illness, was actually swimmer's ear. And we know a good portion of swimmer's ear, or acute otitis externa, is caused by Pseudomonas. I think the findings of this waterborne disease illness study has really started getting us here at CDC thinking about biofilms. I do agree that it is an issue. It is an issue whether we're talking about Legionella and Pseudomonas and those being protected in hot tub biofilms, or maybe even now Naegleria, or the brain-eating amoeba in splash pads, or Pseudomonas and pools and swimmer's ear. I think that's something we're trying to figure out what the way forward is and how best to address it, because pools are a big player, but there are also other water systems. So yes, it is on our radar, and yes, we are thinking about it. And Daisy, if you'd like, I can send you that paper to distribute to the group.
Thank you, Michelle. Yes, that would be wonderful. We can attach it as a resource in our follow-up email. So I have exactly 3 p.m. here on the East Coast. So unfortunately, we'll have to close out the Q&A portion of today's webinar. Unfortunately, we could not get to all of the questions, but if you like, you can definitely email us at macnetwork@nature.org. We'll be happy to forward your questions to our panelists and get back to you. And we'll also be sharing to all our registrants, we'll be sharing the recording of today's webinar together with a copy of the slides. With that, I want to say a big thank you to Dewey and to all our panelists, for Samaria, Joe, Michelle, for joining and helping with our Q&A portion. We really appreciate your time. And for everyone that joined us, we'll stay in touch, and please look forward to our next webinar in a few months. We hope everyone have a wonderful and a safe summer. Have a great day. Bye-bye.